Meanwhile, no cases have recovered from COVID-19 today. Therefore, the total number of cases is 124 individuals. This brings the number of active cases still being treated at the National Isolation Center to 13 cases, where 2 are still in critical condition and both requiring heart-lung machine or ECMO and respiratory assistance. Meanwhile, the rest are in stable condition. At this time, 58 individuals are currently undergoing quarantine in accordance to the Infectious Diseases Act, Chapter 204, and a total of 2,517 individuals have completed their quarantine. In the past 24 hours, a total of 137 samples have been tested for the SARS-CoV-2 virus. It brings the total number of lab tests conducted since January 2020 to 13,717. With regard to cases that have recovered but found to be positive again during follow-up examination, the Ministry of Health informs that there is no case that have retested positive. Meanwhile, 1 case has been allowed to return home. This brings the total number of such cases as of today to 22 individuals, of which 6 are still undergoing further examination and testing. According to several studies carried out in some countries on COVID-19 patients that have recovered but found to be positive again, the Ministry of Health informs that there is no evidence that they can infect others. For such patients in the country, the Ministry of Health has clear and comprehensive guidelines for a follow-up examination. Any patient that has recovered but found to be positive again will be admitted to the National Isolation Center for further investigation and treatment and will be instructed to undergo 14-day self-isolation after being discharged from the center for the second time. Therefore, the public should not worry for risk of infection from former patients. They can carry on with their normal life and go back to work as usual after completing their isolation period. Employers should not take any action such as forcing them to take unpaid leave or isolate them from others. It is sufficient to ensure precautionary measures are carried out in the workplace, such as self-hygiene, frequently washing hands with water and soap or disinfectant, as well as practicing physical distancing. Avoid discriminating former COVID-19 patients. For further information and latest updates, visit the official website at the Ministry of Health at moh.gov.bn or by contacting the Health Advice Line 148 or through the web application healthinfo.gov.bn.